We spoke about the leg pain and knee pain, guys. It could be we take the knee from out in, from outside in. Could be a soft tissue that is paining, so we treat that first. What after the soft tissue? Before we go to the bony knee, there's nerves and there's vessels. So if the vessels is the cause of the pain, how we treat? If I squeeze here and it hurts, does it hurt when I squeeze? Okay, squeeze here and it hurts. This is called a positive Hoffman sign. We spoke about that. This could be a sign of a pre-diabetes or diabetes or high hemoglobin A1C. If not diabetic, what is? The most common cause could be a precipitations in the veins. The blood vessels we spoke about the blood has cells and has plasma. The same way when you make a coffee, the coffee ground go down and the water up. The tea go down. When you make a tea, the ground go down and water go up. Juice is the same. Same with the blood. The cells go down and precipitate in the leg and the plasma up. So how are you going to clean this? This precipitates that cause, if we ignore it, it can cause a clot. The clot in the veins could make swelling, could make redness, could make inflammation, but there's not the clot yet. But we need to treat it before. There's a clot, smaller clot here, can travel with a bloodstream, go in a small artery in the heart, cause heart attack, which we might call the function, block the heart, block blood from going some place in the heart, causes this heart muscle to die, the wall of the heart muscle to die. Or can go in the brain, and a small artery in the brain, block it, because here it could be a big vein, could be a big vessel, and the brain could be a small artery, because they have bigger and smaller and smaller. Like small artery block the blood, causing what's called stroke. People could be lose the eyesight, could lose one side of the face, could lose a hand, cannot move the hand or the leg. That's why it's very serious. That disease is called the Beurger disease. It's a peripheral vascular disease. Anyway, anything we need to examine for any peripheral vascular disease, something called capillary refill test. What is capillary refill test? If you go here and check like this, I press and leave, this become pale. Pale means the blood, see now it's pink. You press, it becomes pale. It's supposed to refill. Now I'm emptying the capillaries. It's supposed to refill in 6 seconds. You leave and count 1, 2, 3, 4, 5, 6. Okay, if it fill up within less than 6 seconds or 6 seconds, it means there's no BVD, no peripheral vascular disease, good capillary refill time. If people have peripheral vascular disease, capillary refill time become longer than 6 seconds. Now, the doctor who discovered this condition when you squeeze and it hurts, and BVD, is called Dr. Beurger. And he made one exercise to treat the condition. It's called the Beurger Exercise. To do the Beurger Exercise, we're going to do one leg at a time. The waist will be out at the edge of the table. The upper body stay inside to safety so you don't fall. Then what we're going to do now here, guys, the knee should be straight but not stretched, not be kinked, because we have vessels here and I want to empty all the blood. Imagine when we do this exercise, you're having the juice cup. The cup after the juice, you want to wash it. You put water, you shake it, you flip it, put another clean water and shake it, drink. Same if you want to wash the coffee cup or the tea cup from the ground, you put water, you shake it, you bring it down. Same, so I want to empty all the precipitates, you clean all the vessels here. How are you going to do that? Same way when you go to the toilet. What you do in the toilet? You pull, allow water flush, take all the dirt and go away. Okay, guys? Then we're going to do here now. We need the knee to be straight, but not kinked. If you kink it like bent, you're going to kink the vessels, not to drain. If it's too tight, stretch it, it's not good at all. Just like 5 to 15 degrees. I'm going to put this here. So what I'm going to do, you're going to move your foot up and down. When you're doing this, as far as you can, all the way up, all the way down. We need to go, keep going, no stop, keep going, no stop. When you do this here, guys, we're using the muscle here. This muscle, when the muscle contracts, it squeezes veins and the lymph vessels to pump the blood and the fluids back down there, okay? Keep working, no stop. He will do this no stop, but has to do work really hard. Push down as much as you can, go up as much as you can, till either he get tired or you look here and become pale. It was pink, become pale. When become pale, mean the blood is emptied. Then you drop this down here. I want you to pay attention, please, mommy. It's good for you. When you drop it here, this you flush. You know what I mean? You flush the blood, go down here. We're gonna clean up the vessels. Okay, with the blood down here now. So flush the same way you flush the toilet. Then you do this down there for 6 seconds. 1, 2, 3, 4, 5, 6, and lift up again. Okay, and move. And I'm gonna repeat this. And the first day I will do 6.
Yes. No.
Okay. You're gonna repeat this six times. First day. Second day you can do 10 times. You can do more. Why? Because in the beginning, if you drop this down here, you're gonna be stretching this muscle here. When the muscle you stretch it and you never stretch it before, this can cause soreness here for a few days. Don't worry, it's gonna go away. Okay. When you do this exercise, and you're repetitively doing this, it takes you this tenderness. If you do the exercise properly, this is supposed to go. The tenderness will go away in 4 or 5 days. The people who take it serious and do exercise serious, but people don't take it serious, just take it as a joke, as a game, they'll never get better. So we need to take it serious. Move out, please, my brother. Okay, this is the way you do it. This out. Then you're gonna keep the knee like this. I like this way because it's straight now. Move your foot up and down, all the way up. No, move down strong, up strong. The muscles here, muscles are peripheral pump. You know, we have in the circulatory system, we have 3 pumps. One, the primary pump is the heart, the pump of the blood from the heart, go down with the gravity to the legs. Then how come blood come back to the heart? The one central pump also is the respiration. When you take a deep breath, inhale, you make your chest bigger, you create negative pressure inside your chest, like a vacuum, like a syringe, pull the blood from the legs, venous return back to the heart. Not only that, when your muscle works, squeeze the veins and vessels, pump the blood back to the heart. Okay, this is what we do now. What I showed you is called modified Beurger exercise. Why? Because the real Beurger exercise, he used to get like a tourniquet after he empty here, keep moving, keep moving, keep moving, till he get tired. This became pale, this pink become pale or tired. You go with the tourniquet and you go here and you tie it hard. Okay, 1 second. You tie this hard. When you tie this hard, here. Now you block the vessels. So you bring it down and you take it, you open it. When you open this, the blood will rush it. So this is a real Beurger. You can do with a tourniquet. Be careful, don't hurt yourself. And you do 6 seconds and wait till the blood come back and you lift it up again and use the same ball and keep repeating 6 times. First day, 10 repetitions, second day. Trust me guys, if you do it serious, the tenderness in the calf, if it's because of the vascular, because of BVD or vascular issues, or precipitates in your veins, it will go away in 4 days. But if you take it serious, if not, it didn't go away, it could be diabetes or pre-diabetes. If you get it checked, it's better to be safe than to be sorry. Get checked to check your blood sugar, check your hemoglobin A1C. And by now, please pass this information. Many people need this information. Pass it around. If it's the first time, press subscribe and press like, share it with your friends, and bye now.